The World Health Organization is warning against vaping, saying urgent action is needed against the popular e-cigarettes among young people. WHO says the highly addictive toxic substances contained in the cigarettes are harmful to health. A study from the University of Pretoria has revealed that over 6,000 young adults aged between 18 and 34 are vaping, exposing them to potential health risks. To talk more about this, I'm joined now by Director of the Africa Centre for Tobacco Industry Monitoring and Policy Research at the University of Pretoria, Professor Olalekan Ayo-Yusuf. A very good morning to you. Welcome to Newzroom Afrika. Interesting take as we take a look at the popularity of e-cigarettes and how they've been made to look like they're trendy and the accepted norm, but there are dangers. Talk to us about them.
Well, thank you very much, Paul, and good morning to your listeners and to your viewers. So, indeed, e-cigarettes in South Africa has become very popular. We've been tracking e-cigarette use in South Africa nationally, particularly among young people for the last 15 years. And we've picked up that e-cigarette use amongst the 16 to 34 prevalence moved from about 0.3% to about 4.1% from 2010 to 2021. And that's estimated to about 1 million young people in South Africa using e-cigarettes. The reference you made earlier was what a smaller study of 6,000 young people that we surveyed. So in the country in total, we estimate about 1 million South Africans currently use e-cigarette. It's not without harm, and it's because it's not regulated in South Africa. The advertisement is quite common, and students are exposed. About 1 in every 4 16 to 19-year-old that we surveyed reported to have been exposed to an advert. And usually these are people who are very impressionable. Mm-hmm. Irrespective of their cognitive ability, they get peer pressured and they get sucked in by the adverts to make sure that they're socially acceptable.
The alarming evidence on hostile population health effects. I mean, you say, you make mention of how there is no regulation in South Africa, and that itself gives leeway to harmful substances contained in these e-cigarettes that nobody knows of, but of course the body will suffer the effects.
That's correct, because it's not regulated. So you've got the customizable ones, which is open tanks. You can put in the liquid, and of course, you can put any liquid. We don't know where these manufacturers come from. And you have the closed system where they have maybe just 2 mils, or disposable, which is now becoming very common, full of flavors to attract young people. Importantly is that over time, we've now seen an increased concentration of nicotine in these products. I know nicotine does not cause cancer, but nicotine is very bad for the cardiovascular health. It's a vasoconstrictor. It increases heart rate, increases blood pressure. And in South Africa, where 1 out of 5 people might have hypertension, sometimes they know, some they don't know. It is not a good idea to expose the population to high levels of nicotine. It's even worse if you are pregnant for the fetus or for a young adolescent whose brain is so plastic and therefore easily addictable to these high levels of nicotine. So you've noticed that in the market, they've moved from ordinary nicotine or protonated to the nic salts, and that goes as high as 50 milligrams of nicotine in this disposable type of e-cigarettes, which is very addictive and dangerous.
The marketing also came with a perception that vaping is less harmful than smoking, thus making it the better of inhalants such as this. What's your thoughts around that? One being less harmful than the other. But we know that regular tobacco cigarettes contain over 7,000 chemicals, many of which are toxic.
Indeed. There's no argument about what is less harmful than the other. The issue is, should we be taking something that is harmful? Particularly adolescents who are not even smokers. So they get recruited into nicotine addiction when they're not even smokers. So the issue here is the e-cigarette is supposedly positioned to help smokers, adult smokers. But our study has shown that the adult smokers are not helped by e-cigarettes. We've surveyed about 18,000 South Africans, which included about 2,000 e-cigarette users who also smoke. And we found out that after 6 months, they relapse much more than those who did not use e-cigarette to try to quit. So if it's not helping smokers, we do not need it to be exposed to young people who are not even smokers. So the net effect, public health effect, is actually harmful at the population level.
What about it being an effective tool, well, marketed as such, to help people quit smoking?
And that's exactly what I've just explained. And the WHO's call to action has clearly stated that in the real world evidence, there are 2 ways you can get information. Randomized controlled trial, which is an experiment. You get people and control what they use and give them. That works. But in the real world, when you are not controlling what people are using, and you do not have the data that suggests that it helps people to actually quit. In fact, in the experimental condition, you get 3 extra people out of 100 people that are able to quit than compared to NRT. But when you have 4 young people starting, the net public health effect is actually worse than if you didn't have e-cigarettes.
So in your study, what are some of your recommendations?
So our recommendation is to regulate e-cigarettes to the extent that we can protect the next generation of young people. If smokers in future, it happens to help them, even with regulation, they will still be able to access e-cigarettes. So currently, without any regulation, with all of these flavorants, with all the adverts, you can smoke anywhere. We are now already denormalizing smoking in public places because e-cigarettes is now used everywhere. So the recommendation is to regulate e-cigarettes, the way we regulate advertisements of tobacco, the way we regulate adding taxes, significant taxes to make sure young people cannot afford it, the way we make sure that people are not able to use in public places so that you do not send the wrong message to young people. All we're asking is to regulate e-cigarettes.
Is there any reason why all of this was seemingly bypassed? Was it the marketing of the e-cigarettes that led to the regulation part of it being bypassed for it not to be regarded as a regular cigarette?
So, indeed, it was because the current regulation in South Africa passed in 1995. There was no e-cigarette at that stage, and nobody even anticipated something like e-cigarette. And then the tobacco industry, which were now pretty much behind e-cigarette, they've come with a lot of tactics. And they went to court because e-cigarette was originally regulated, or actually I must say, in real sense, is regulated under the Medicine Control Act. But they went to court and said, but this is not medicine, it's not a cessation aid, it is a consumer good. Now they start marketing it as a cessation aid 10 years later. So they really have been ducking and diving. And we've always said, if it's a cessation aid, just like NRT, go to the SAPRA and regulate it as a medicine. If it's not cessation aid, then gets regulated like any tobacco product, like in the U.S. So they allow e-cigarette regulated in the U.S., the same companies, but they come to South Africa and ask South African government not to regulate it like cigarettes.
Very well. Thank you so much for your time. Professor Ayo-Yusuf, the National Council Against Smoking there, really reacting as more and more calls, especially by the World Health Organization, for urgent action against vaping and e-cigarettes. Speaking there to some recommendations from the study of the University of Pretoria aligning to regulating the industry.